A viral load test request form should be filled out every time a viral load sample is taken. The form has a tear-off part that must be sent with the sample to the lab. The rest of the form remains at the facility. Complete both parts of the form and remember to update the part at the facility when the results come back. Let's start by learning how to fill in the part of the form that will be sent with the sample to the lab. In the province field, write the name of the province where your facility is located. For example, this patient is visiting a facility in Mashonaland Central Province. In the district field, write the name of the district where your facility is located. For example, this patient is visiting a facility in Mazoe. In the clinic field, enter the name of your facility. This patient is visiting Dambo Clinic. Specifying the province, district, and facility or clinic where the sample is being collected is important so that the laboratory knows where to return the results after processing the sample. All three fields must be filled in to prevent confusion. Some clinics in different provinces or districts have the same name. Write the name of the clinician who ordered or carried out the test in the clinician name field. For example, Dr. Claudius Muserere ordered a viral load test for this patient, but he didn't actually draw the blood sample. Enter the date that you collect the sample using the format on the form. Let's say you're drawing a sample for Dr. Muserere's patient on 4 September 2017. In the DD field, you write 04. In the MM field, you would write 09, since September is the 9th month. In the YYYY field, you would write 2017, not 17. In the time field, enter the time you collected the sample. In this example, it's 09:14 AM. Noting the time is critical because some viral load samples are supposed to reach the laboratory within a specified period. Lab personnel record the time when they receive the sample and calculate the time difference to determine whether the sample is still suitable for processing. In the first name and surname fields, write the first or given name of the patient and his or her surname or family name. In this example, the sample being drawn is for Innocent Mahonga. Write the patient's OI number in full. Be sure to include the province code, the district code, the facility code, the year, and the OI sequence number. Entering incomplete OI numbers will make it harder to identify which lab results are for which patient. Tick the appropriate box to indicate the gender of the patient. If the patient is a boy or a man, tick male. If the patient is a girl or a woman, tick female. Don't tick both boxes. In the date of ART initiation fields, enter the date patient was initiated on ART. In this example, Innocent Mahonga was initiated on ART on 23 November 1998. Note that the month has been entered as a number and all 4 digits of the year has been written. You will need the patient's book or the green book to find the ART initiation date. Don't leave this field blank. In the current ART regimen field, write the regimen that the patient is currently taking. Check the regimen in the patient's book or green book. In this example, Innocent is taking Tenolom and efavirenz. If you know the abbreviations, you can write them instead of the full name. In this example, you could write TDF/3TC/EFV. Enter the patient's date of birth in that field. Follow the format using 2 numbers for the date and month and 4 numbers for the year. If you don't know the date of birth, enter the patient's age in the next field. If the patient is younger than 1 year old and you don't have the date of birth, write the age in months in the space provided. Let's say you're testing a 3-month-old boy. His caregiver doesn't know his exact date of birth, but thinks the boy is 3 months old. In this case, you'd enter 3 months on the form. These next 2 fields pertain to women of childbearing age. If the patient is pregnant, tick the yes box. Be sure to probe for this information. Ask the patient when her last normal menstrual period was. You may need to do a pregnancy test if you suspect the patient is pregnant. Tick the no box If she isn't pregnant, don't tick both boxes. Tick the yes box if the patient is currently breastfeeding. Tick the no box if the patient isn't breastfeeding. Don't tick both boxes. It's important to indicate that a woman is pregnant or breastfeeding so that the sample will be prioritized. By quickly processing these samples, the risk of mother-to-child transmission of HIV will be minimized if the patient's viral load is high. Ask the patient if he or she is willing to have his or her results communicated to him or her via mobile phone. Be sure to clearly explain the kind of information that will be shared. SMS is the quickest way to inform the patient of his or her results. If the patient's viral load is high, changes to treatment can be made sooner the earlier the results are known. If the patient consents to learning the results via SMS, tick the yes box in the patient's consents to SMS field. For those patients who consent, write their mobile number clearly on the space provided. If they have more than one mobile number, such as with different network providers, write down these other numbers as well. If the patient refuses, tick the no box. In the date of last viral load tested, enter the information from patient's notes or green book. Note that the date follows the same format as in other places on the form. Using the patient's notes or the green book, enter the results of the last viral load test. The next several fields are for documenting the reason for the test. If you're doing a routine viral load test, tick the routine box. For patients newly starting ART, a routine test is done 6 months after initiation. For patients who have been on ART after 6 months, a routine test is done each year. If you are doing a viral load test because the patient has developed a stage 3 or 4 condition after being on ART for 6 months, tick the target clinical failure box. Tick targeted immunological failure box if you are doing a viral load test because the patient has a CD4 count that remained below 100 after 6 months on ART. If the patient has a CD4 count that has fallen below an abnormal baseline, or if the patient has a CD4 that has dropped by more than 30% after 6 months of being on ART. If you're doing the viral load test to check whether the patient's viral load has dropped after he or she had interventions to improve adherence, like counseling, tick repeat after enhanced adherence box. The repeat viral load is usually done after at least 3 months of the initial detectable viral load being above 1000. If you're testing a patient's viral load for reasons not specified on this form, tick the other box and write in the reason specified. Some examples include when assessing transmission risk to a health worker after an accidental needle prick injury, or in rare circumstances when a baseline viral load test is needed before ART initiation. If a patient has received enhanced adherence interventions, tick the yes box if poor adherence was identified. Otherwise, tick the no box. Tick the number of enhanced sessions the patients received. The for laboratory use only section will be completed by lab personnel. Do not write anything in this box. Now let's talk about the other part of the form. Each form has a barcode, which is used as a unique identifier for each sample. For PPT and EDTA samples, attach this barcode to the vials. For DBS samples, attach the barcode to the envelope. Let's look at the information to enter on this part, which remains in the book. The information on this part of the form should be the same as the information on the other part. If the information is different between the two parts, the sample may be discarded. Enter the date you collect the sample using 2 digits for the date, 2 digits for the month, and 4 digits for the year. In this example, we collected the sample on 04/09/2017. Write the time you collected the sample. Write the patient's full name, that is first name and surname. Enter the patient's OI number. Be sure to include the province code, the district code, the facility code, the year, and the OI sequence number. If you don't enter the entire OI code, it will make it harder to match the results to the patient. If the patient has agreed to learn about his or her results via text, clearly write his or her mobile number on the space provided. If he or she has alternative mobile numbers, write this down as well. As soon as you receive the viral load test result, enter it on the form. Also write down the date you received the result using 2 digits for the day, 2 digits for the month, and 4 digits for the year.